serves and represents all of the people in our country, it has a very special constituency, and that is the men and women who have put their lives on the line to defend their country. Those are the people who utilize the VA every day. And today we're very pleased to have representatives from many of the major veterans organizations here with us, and I thank them all very much for being here. We are all interested to hear about your members' experiences with VA healthcare services. You know more about it because your people access the system every day. And we look forward to hearing your suggestions and your criticisms on how the VA can do better. I would like to remind each of you to keep your oral presentation to 5 minutes. And of course, your full statement will be printed in the record of the hearing. Our guests today are Daniel M. Dellinger, who is the National Commander of the American Legion, Joseph A. Violante, a National Legislative Director for the Disabled American Veterans, Tom Tarantino, Chief Policy Officer for the Iraq and Afghanistan Veterans of America, Carl Blake, who is the National Legislative Director of the Paralyzed Veterans of America, D. Wayne Robinson, President and CEO of Student Veterans of America, Ryan Gallucci, Deputy Director, National Legislative Service, Veterans of Foreign Wars of the United States, and Rick Weidman, Executive Director for Policy and Government Affairs of the Vietnam Veterans of America. I want to thank all of you for your honorable military service and for being with us today. Commander Dellinger, we will begin with you, please.
Good afternoon. Yesterday we learned of a veteran in Vermont who died while trying to get mental health care from his local VA. His wife complained he would have to wait for hours just to be bounced around to different counselors. The American Legion expressed our concern about this very issue before the House Veterans Affairs Committee at the beginning of April, and again before this committee at the end of April. Our testimony is a matter of public record. Chairman Sanders, Ranking Member Burr, and distinguished members of this committee, on behalf of the 2.5 million members of the American Legion, plus another million of our auxiliary and sons family members, thank you for holding this hearing and inviting me to share the views of the largest veterans service organization in the nation. 2 days ago, I was in Phoenix, Arizona. My sister Morse Sabian and I hosted a Veterans Hall meeting which lasted almost 4 hours, attended by over 200. 62 spoke passionately about scheduling issues, over-medicating, and various other concerns at the hospital. I will be happy to discuss the details of that meeting with you during the question and answer period if you'd like to hear more about the information gathering session. So I am here today to help you understand why the American Legion believes the VA needs to address specific deficiency, and also let you know that the American Legion fully supports the Department of Veterans Affairs. We supported the creation of the Veterans Administration in 1930 and fought hard to get VA elevated to cabinet level in 1989. We donate hundreds of thousands of hours each year to the VA, along with millions of dollars, and have scores of claims representatives. We help fund a brain research center in Minnesota and are currently representing 750,000 veterans as they file their claims with VA. Make no mistake about it, the American Legion believes in the VA. The allegations of the secret waiting list at Phoenix Department of Veterans Medical Center that are now being investigated, along with the 40 or more patient deaths, have rocked the veterans community. In addition to Phoenix, we now understand at least 6 additional VA locations have been identified as participating in veteran patient wait time manipulation. The allegations in Phoenix were not the only reason the American Legion decided to call for a leadership change at the VA. They were simply the final straw in a long list of systematic leadership failures that include construction delays and cost overruns, patient deaths due to Legionella, patient infections due to unsanitary colonoscopy equipment and dental equipment, unacceptable wait times for colonoscopies resulting in patient deaths, the abandonment of efforts to create a true, unified, and interoperable joint health care record for use by both the Department of Defense and Department of Veterans Affairs, VA's refusal to answer congressional inquiries, and VA's witnesses' failure to disclose all relevant truths when testifying before Congress. On Tuesday, we heard that Senator McCaskill is concerned enough about mismanagement and mental health waits at the St. Louis VA that she drafted a bipartisan letter with Senator Blunt to get to the bottom of it. The list continues to grow. When are things going to get better? It seems that a day cannot pass without a news report about the problems and difficulties the VA faces with delays and quality of care challenges. While we wait for things to get better, hundreds of thousands of veterans are waiting for a decision on their initial disability claim or appeal, which prevents them from receiving VA health care. While we wait, transitioning service members are falling through the cracks due to DoD and VA's inability to create a single interoperative medical record. While we wait, officials in VA Central Office are preventing hospitals from being transparent during a crisis. While we wait, veteran suicides continue to plague our nation at a rate of 22 per day, with no clear strategy from VA on proactively addressing suicides. Again, I'd like to thank you for this opportunity to speak with you today and welcome your questions.
Thank you very much, Commander Dellinger. Mr. Violante.
Chairman Sanders, Ranking Member Burr, and members of the committee, thank you for inviting DAV to testify today about the state of VA health care. DAV remains deeply concerned about allegations that VA employees or management took actions that obscure the true picture of access problems at some VA facilities. We fully support the ongoing investigation by the Inspector General and will demand full accountability for anyone found to have violated the laws or failed to follow and enforce VA rules and regulations. We also support Secretary Shinseki initiative to audit all VA facilities to determine whether similar problems are occurring. However, we strongly recommend the VA include outside third-party experts to increase its objectivity and credibility and help regain the full trust of veterans and the American people. Mr. Chairman, while no health care system is perfect and medicine is far from an exact science, veterans have earned the right to expect the VA health care system to provide high-quality medical care. While it may be weeks or months before the investigations and audits are completed, we continue to have confidence that the VA, led by Secretary Shinseki, can and will correct any problems identified or uncovered. This Secretary has a track record of directly and honestly confronting problems and working with stakeholders to correct them. Mr. Chairman, we continue to believe that VA provides high-quality health care for the vast majority of veterans treated each year, and that veterans are now and will be better served in the future by a robust VA health care system than any other model of care. The real challenge facing VA and the root cause of the problems being reported today have to do with access to care rather than the quality of care delivered. For the past decade, DAV and our partners in the independent budget have pointed out funding shortfalls in VA's medical care and construction budgets. In the prior 10 VA budgets, funding for medical care provided by Congress was more than $5.5 billion less than the IB recommended. For FY 2015, the IB recommends over $2 billion more than VA requested. I would point out that you, Mr. Chairman, did call for an increase of $1.6 billion for FY 2015, but based on available information today, it appears your Senate colleagues will not significantly increase the administration's inadequate request, just as the House already failed to do. Similarly, over the past decade, funding requested by VA for construction and the amount appropriated by Congress has been more than $9 billion less than the IB recommendations. For FY 2015, the VA budget request is $2.5 billion less than the IB recommendation, which was based upon VA's own analysis. We agree with your views and estimate letters for the past 2 years, Mr. Chairman, where you stated that the administration budget's request for construction has been, and I quote, clearly insufficient to meet the identified needs, end quote, but unfortunately Congress took no action to increase construction funding. Finally, VA needs to better utilize its purchase care authority. DAV believes that whenever an enrolled veteran is unable to receive care directly from VA within established timeframes, VA must take responsibility to find alternative means to provide and coordinate such care. However, since each dollar used to pay for non-VA care is $1 less that is available to hire new VA staff required to treat veterans in a timely manner. VA must provide accurate estimates of the additional funding required, and Congress must appropriate those dollars. Even with sufficient funding, how will non-VA care be coordinated with VA care? Are there even sufficient qualified providers available in each community? Simply giving a veteran a plastic card and wishing them good luck in the private sector is no substitute for a fully coordinated system of health care. Mr. Chairman, looking at VA today and putting it into proper perspective, the entire American system of health care, we continue to have confidence that veterans are well served by seeking their care from VA. We remain confident that VA and Secretary Shinseki, working with stakeholders and Congress, can, will, and must address these challenges. American veterans deserve nothing less. Thank you.
Thank you very much, Mr. Violante. Tom Tarantino.
Chairman Sanders, Ranking Member Burr, and distinguished members of the committee, on behalf of Iraq and Afghanistan Veterans of America, I thank you for this opportunity to share our views and recommendations regarding the current state of health care with the VA. For nearly a decade, IAVA has been a tireless leader working on behalf of veterans and their families to ensure that VA meets the needs of our community. After spending 13 years at war, the VA has been confronted with significant challenges administering timely care and services to veterans. Many have been overcome, but still clearly far too many remain. In the past few weeks, serious allegations of misconduct have arisen from several VA medical facilities, indicating that records are being intentionally doctored in order to falsely portray patient wait times as reasonable and satisfactory. Disturbingly, long wait times have alleged to be the result of 40 deaths, 40 veterans who perished while waiting for care at the Phoenix VA medical facility alone. And since Phoenix, more allegations of misconduct at other facilities from coast to coast are painting a similar picture. Unfortunately, these types of incidents are not new, nor are they apparently unique. It is time for bold reform and new measures of accountability and oversight. Our members are outraged and expect substantive and meaningful evidence that long-standing inefficiencies are being appropriately addressed and appropriate VA personnel are being held accountable. Veterans must be assured that VA can deliver quality care in a timely manner, and veterans are tired of business as usual. IAVA also expects the VA to fully comply with the subpoena issued by the House Committee on Veterans Affairs. Full and swift compliance with this subpoena will be a good first step in not only figuring out what happened in Phoenix, but demonstrating how allegations of misconduct will be addressed at other VA facilities. And just like the Secretary, we are also awaiting the results of the Inspector General's investigation of alleged misconduct in Phoenix. But we can't sit around idle while the investigation is underway. We applaud the full audit of all 1,700 points of care at VA. However, we expect results and action in weeks, not months. Additionally, we support and encourage concurrent investigations that are completely independent of VA. Veterans need to see the Secretary step out in front on this issue and lead. We want a proactive Secretary, not a reactive one. Controlling the public message is critical, and if the Secretary cannot do it, veterans and the American public will continue to lose faith in the VA system. Accountability is a fundamental principle necessary for any organization to properly function. Yet, VA's incidents of mismanaged care would indicate that such a thing is missing from all levels at VA. Secretary Shinseki has finally started to emerge publicly and address these allegations, but we need to be clear that short-term reactive measures will not eradicate the most pervasive problems causing veterans to lose faith in this system. VA has a long way to go to earn back the confidence of millions of veterans shaken by this growing controversy. Although recently exposed by whistleblowers, allegations of long wait times at VA are actually nothing new. The GAO has conducted numerous studies over the last decade touching on scheduling inefficiencies at VA, and their findings continue to center around lack of oversight, inadequate training, ambiguous policies and procedures. In other words, weak leadership. Now, long wait times are one thing. Essentially, they're a management and process problem. They can solve with a combination of people and time and resources and more effective business practices. They are solvable as long as good leaders have the tools and information they need to fix it. That does not seem to be the case here. Instead of leaders coming forward to fix the system, they appear to be fixing the books. This is indicative of a culture of failed oversight and no accountability. Now, reasons for highlighting VA mismanagement and bureaucratic flaws are not done lightly, nor should they be. The worst thing that can happen in our community is a sense that the VA is so inefficient and terrible at administrating care that veterans lose faith in the system designed to take care of their needs. Now, the right answer to this is not to cover up problems in VA, but to solve them or keep them from happening in the first place. And this isn't just a matter of communication, it's a matter of lives. Of the estimated 22 veterans who die by suicide per day, 17 have not sought care at the VA. Despite the VA's many problems, seeking care works and can save lives. It is absolutely critical that veterans who need care feel encouraged to seek it. In order to improve the system of care and reassure veterans about VA's capabilities, legislation such as the Suicide Prevention for American Veterans and the VA Management Accountability Act should be enacted into law immediately. Our membership and the veterans community as a whole needs to be reassured by VA and Congress that despite these issues, the VA is there to serve them and that any charges of misconduct will be addressed and swiftly corrected. We also need to ensure that we know the full scope of mismanagement and cover-up at the VA system. This is why IAVA is proud to work with the Project on Government Oversight to protect VA whistleblowers. VA employees can come forward confidentially by going to vaoversight.org. Mr. Chairman, we again appreciate the opportunity to offer our views on this critically important and urgent topic. We look forward to continuing to work with you, your committee, your staff, and the VA to improve the lives of veterans and their families. Thank you for your time and attention.
Thank you, Mr. Tarantino. Carl Blake is the National Legislative Director, Paralyzed Veterans of America. Mr. Blake.
Chairman Sanders, Ranking Member Burr, and members of the committee, on behalf of Paralyzed Veterans of America, I'd like to thank you for the opportunity to testify today on the state of health care delivered by the Department of Veterans Affairs and the spinal cord injury system of care. No group of veterans understands the full scope of care provided by the VA better than PVA's members, veterans who have incurred a spinal cord injury or dysfunction. PVA members are the highest percentage users of VA health care. Let me begin by saying that PVA is deeply disappointed by the number of reports from around the country that suggest that veterans' health care is being compromised. There are undoubtedly serious access problems in the VA. I'd like to associate myself with the comments made by Senator Isaacson and Senator Begich regarding gaming the system and, for all intents and purposes, cheating the standard. If that's going on, and when cases are found where that's going on, serious and appropriate actions should be taken. If that means people have to be fired, so be it. That's what has to happen. However, we believe that a thorough analysis to understand the depth of this situation across the system should be completed before any final decisions about the VA leadership are made. At this time, PVA fully stands behind Secretary Shinseki. We believe he's committed to fixing these problems, and he should be afforded the opportunity to get it right. I'd like to emphasize, however, that the narrative that has been created by the media does not necessarily reflect what is happening inside the walls of the VA healthcare system. The committee really wants to gauge what is going on and how the quality of care is being delivered. I would ask you to spend a day walking around inside a local VA hospital, talking to veterans and discussing their health care experiences, not sitting in front of a pre-screened, pre-selected panel of veterans to support sweeping generalizations and to stoke public outrage. The fact is that the VA healthcare services, by and large, are excellent. Patient satisfaction surveys of the VA support that assertion. The primary complaint that we hear all of the time from veterans is how long they had to wait to be seen for an initial appointment or to receive care. At its core, this is an access problem, not a quality of care problem. These are not the same thing. And to be clear, sending veterans outside of the VA to get private care is not the solution to this problem. It might be part of a solution. It is not the solution, particularly for veterans who rely on the VA's specialized services. The fact is that there are not comparable services to the VA's SCI service, blinded care, amputee care, and the wide variety of specialized care that the VA provides in the private sector. Our written statement provides a snapshot of the VA spinal cord injury system of care. We've clearly identified serious staffing shortages that exist in the SCI service, particularly on the nurse staffing side. The site visits that we have conducted with our medical services teams for nearly 3 decades provide us the unique authority to affirm those problems. Unfortunately, those staffing shortages severely limit access to the system, while also placing the healthcare delivery for veterans at risk. Insufficient staffing, and by extension, insufficient capacity, is ultimately a reflection of insufficient resources that this administration and previous administrations have requested for health care, and insufficient resources that Congress has ultimately provided. The independent budget, co-authored by PVA, AMVETS, DAV, and the VFW, has made recommendations to adequately fund VA health care for 28 years. For the last several years, Congress has essentially ignored our recommendations. And now here we are discussing how could this have all happened. I would agree with Senator Johans, who indicated, what the heck is going on when he looks at this and considers the budgets that have been requested. I'd suggest that the great irony of this hearing today is the discussion about, is the OIG adequately funded to do these investigations? Is the VA healthcare system adequately funded to deliver timely, quality care? I would suggest the answer to that question is no. Until the Congress and the administration commit to providing truly sufficient resources to hire adequate staff and establish real capacity, the problems being reported around the country will only get worse. The administration and Congress both bear the responsibility of these problems. Veterans pay the cost, sometimes with their lives, of inaction resulting from partisan bickering and political gridlock. Political interests do not come before the needs of the men and women who have served and sacrificed for this country. We call on this committee, Congress as a whole, and the administration to redouble your efforts to ensure that veterans get the absolute best health care provided when they need it, not when it is convenient. PVA members and all veterans will not stand for anything less. I thank you again, Mr. Chairman. I'd be happy to answer any questions that you might have.
Thank you very much, Mr. Blake. D. Wayne Robinson is the President and CEO of Student Veterans of America. Mr. Robinson.
Chairman Sanders, Ranking Member Burr, and members of the committee, thank you for inviting Student Veterans of America to submit our testimony on the state of VA health care. As the premier advocate for student veterans in higher education, it is our privilege to share our on-the-ground perspective with you today. I'd like to begin by addressing the family members of the veterans for whom we are gathered today. We at Student Veterans of America honor the service of your loved ones and stand with you in seeking answers related to their deaths. Student Veterans of America, or SVA, is a network of over 1,000 chapters on as many campuses across all 50 states and 3 countries. These chapters are comprised of veterans from multiple eras of service, with the majority having served after 9/11. Paramount to their success is the ability to remain healthy and utilize the healthcare system provided by the Department of Veterans Affairs. In this testimony, we speak on student-level issues of health and well-being, with our main focus being on higher education. As the GI Bill makes up a major portion of the benefits administered by the VA, we believe it is essential to consider education and the role it plays in the life of veterans who may simultaneously be receiving health care. As a former Command Sergeant Major in the Army, with service spanning nearly 3 decades, and as the current leader of a large, disparate organization, I understand how difficult it is to be responsible for many locations and workforces. I also understand the position of older and younger veterans, as I've served alongside, have led, and have been taught by both. Many of these friends and former leaders of mine ensure that I remain abreast of the issues they face while accessing care. Some student veterans are as diverse as our nation and are progressing toward degrees at varying stages of their lives. Likewise, our members have millions of experiences with the VA and other large institutions integral to their success on a daily basis. They rely on the VA every day for their livelihood, their health care, and the future success of themselves and their families. This support system for student veterans may be understood by looking at 3 levels of support, which we term the 3 pillars. We encourage this committee to focus on the following 3 pillars of student veteran well-being individually as well as collectively. Pillar 1, institutions. Institutional support for student veterans is an important aspect of maintaining a strong pipeline of successful veteran graduates. Pillar 2, individuals. Establishing an environment for the student veteran to fluidly interact with the institution and the community is a determining factor of well-being. Pillar 3, communities. An established network across various university offices, academic networks, and career services enables the student veteran to make the transition from the campus to a fulfilling career. It is the firm belief of SVA that the VA has successfully overhauled the education benefits process and that the same level of production should be sought within all components of the department. Over the last 5 years, Secretary Shinseki has led the VA as it brought GI Bill processing times down to just 1 week and tripled the number of vet success on campus sites across the country. In that same time, the VA has paid out more than $40 billion in tuition and benefits to nearly 1.2 million veterans, service members, and their families since the post-9/11 GI Bill went into effect on August 1st, 2009. We recognize that the VA has a long way to go on some of its programs. It is our sincere hope that the Secretary is able to achieve the kind of outcomes across the department that he has accomplished for student veterans with the implementation of its benefits programs. SVA believes that Secretary Shinseki is dedicated to Americans' veterans more than ever. It has been under his leadership that the VA has seen substantial improvements over the years. While the recent allegations are disturbing indeed, we would encourage the Secretary to take swift and decisive action when the full facts become clear. This action would demonstrate his continued commitment to student veterans who utilize the VA healthcare system and to veterans everywhere. We thank the chairman, the ranking member, and the committee members for your time, attention, and devotion to this cause. As always, we welcome your feedback and your questions.
Thank you very much, Mr. Robinson. Ryan Gallucci is the Deputy Director of the National Legislative Service, VFW. Mr. Gallucci.
Thank you, Mr. Chairman. Ranking Member Burr and members of the committee, I wish I didn't have to be here today, but on behalf of the 1.2 million members of the Veterans of Foreign Wars, I want to thank you for the opportunity to share the VFW's concerns on VA healthcare delivery. Simply put, VFW members are outraged, and I'm personally outraged that the healthcare system that I use may be doing harm to my fellow veterans. What is more frustrating is that nearly a month after some of these allegations came out, we still do not have the facts. We do not know who the veterans are who may have died waiting for care in Phoenix. We do not know where hospitals are cooking the books and appointment scheduling to keep up appearances while veterans wait for care or pay for it out of pocket. Regardless of what comes out in Phoenix, Wyoming, Atlanta, Chicago, Spokane, or elsewhere, the VFW knows that veterans have died waiting. This is inexcusable. VA is supposed to have protocols in place to make sure this never happens. So what happened? VA tells us the situation is improving, but to the veterans affected, this is not good enough. Over the last month, we see that VA may not be living up to its obligation to provide our veterans with the best care our nation has to offer. Veterans deserve the truth, not vague platitudes about quotas, wait times, and pending investigations. The VFW has been frustrated at the situation, but we have been reticent to condemn individuals without all the facts. We're here today to say that enough is enough. Whistleblowers first brought problems in Phoenix to the attention of VA and Congress as early as 2010. CNN broke the doors off this story a couple of weeks back. Why are we still waiting? Last week, the VFW grew tired of waiting and told veterans to call our helpline, 1-800-VFW-1899, to voice their concerns and connect with some of our service officers to help. While some said they were satisfied, most painted a picture of a VA healthcare system that is overburdened, under-resourced, and many times paranoid. In Durham, North Carolina, an Iraq veteran told me that he can see his primary care doctor only once a year and that he has sought care elsewhere, out of pocket, after 10 years of misdiagnoses. What we've heard over the last week is only a small sample of the hundreds of concerns we heard from veterans from coast to coast, but the outpouring of concern was alarming and seemingly systemic. So what is causing this failure? Is it a lack of resources, personnel? Is it leadership? The VFW also plans to conduct a series of Veterans Town Hall meetings talking to veterans face-to-face. Once we have finalized locations and dates, we will invite this committee to attend and hear directly from our veterans. As a veteran who uses VA care, I worry that the recent allegations are causing veterans and their families to lose confidence in the system that is designed to support them and care for their needs. If one veteran is not receiving the care he or she needs, it is one too many. VFW members demand answers, and we want those responsible for any wrongdoing held accountable at all levels of leadership and to the fullest extent of the law. With this in mind, the VFW believes it may be time to commission an independent review of VA care. We hope that VA would never intentionally deny care to veterans, but there have to be reasons why care takes so long to be delivered. The VFW worries that the current culture may be focused on making funding fit at every level, as my colleagues from Paralyzed Veterans of America outlined. If this is the case, the culture must change. Leadership at every level must have the confidence that if they have a need, they can ask for it to be addressed. We know capacity is an issue. The VFW and our other partners on the independent budget have for years highlighted the need to increase VA capacity. In 2004, utilization was at 80%. In 2010, 122%. And in 2013, down to 119%, which is still unacceptably high. This undoubtedly affects VA's ability to deliver care. Plus, when there's a lack of resources, there's a tendency to make trade-offs, whether through delaying care or gaming the schedule to satisfy quotas.